Okay. Hello, everybody, and welcome to tonight's workshop. I am so excited that you're here. We are officially strongly into the new year, which is really exciting. And by now, maybe you've made some New Year's resolutions. Maybe you've not followed through on some of those New Year's resolutions. Maybe, like me, you didn't make one to begin with. But what we do need to know is what are we going to be doing moving forward so that we can better serve our patients in 2022. And tonight's workshop is covering what are these 5 eval elements that we've got to stop leaving out of our evals, and then how you can finally crush your oncology evals this year and continue to do so that you can better serve your patients both now and in the long run too. Okay, here we go. There we go. Okay, so first and foremost, thank you so much for joining us today. I know that your time is precious. I'm going to keep this very simple, very straight to the point, because I know that you came here for some really good information and I want to make sure that you get it. So first and foremost, my name is Dr. Elise Cantu. I am an oncology and lymphedema physical therapist. This is my passion, and I love it so much that I actually have a whole podcast devoted just to this. So it's called the Oncopt Podcast. And then when I'm not talking about oncology and lymphedema therapy, I'm a wife, I'm a dog mom, and I live here in Fort Worth, Texas, and I love lots of Texas things. My job, what I do as the OncoPT, is I help physical therapists treat people with cancer more confidently and competently. One of my favorite statistics that I've come across so far is that in the year 2025, all the Americans that are alive at that point, 40% of those are expected to have a cancer diagnosis at some point in their lifetime. 40%. Which is absolutely mind-boggling. So it's no longer a matter of if you will encounter a person with cancer or if you will encounter a person who has a history of cancer, it's when. No matter the setting you're in, no matter the patient population that you're treating right now, you are probably going to encounter a person who either has cancer or has had cancer. And I would bet that you have encountered these patients already, even if you don't know it. So it's really important for us as physical therapists, no matter the setting you're in, no matter the specialty, you need to be comfortable evaluating and treating these patients because you are going to encounter them at some point. Now, maybe you don't become a full-blown specialist, but we need to know what are the basics so that we can start working with these patients effectively and efficiently today. Now, you may be here for a variety of different reasons. So first and foremost, maybe you're brand new to doing evaluations. Maybe you're just out of school and you're starting to get into the workforce and you're new to doing evaluations, and you need a foundation, a starting point to jump off of and start doing these evaluations. Or maybe you're familiar with doing evaluations, you've been practicing for a little while, but you need more oncology specific guidance. You're good with evals, but maybe not so much on the oncology side of things. Or number 3, you're ready to stop stumbling through your oncology evals. Maybe you're doing some, but you know they could be better. So I'm going to pause here, and I want to know who is here with us. If you could pop in the chat below, a 1, a 2, a 3, or a mixture if you're feeling so. But I would love to know kind of where y'all are at tonight, and then I can figure out where my audience is and where I need to really spend some time. Perfect. All right, I'm seeing a 1. Fantastic. I know that we've got a brand new grad here who is officially a licensed therapist. Super congrats. So this is really a good place to start. So brand new to doing evals, need a foundation. Amazing. Regardless of the reason why you're here tonight or why you're watching this later, the eval is a really, really important place to start. And it's one of my favorite places to really start improving my patient care. And then when my colleagues and the students who come through my courses, is because that's really a starting point for a lot of what we do as the physical therapist with our patient. Here we go. So why evals? Again, I just mentioned a little bit about this, but one of the most important things to remember about evaluations is that the eval is often your first interaction with your patient. This is the starting point for so much of what we do as the physical therapist. We figure out what's going on, we make a plan, we start actually doing the plan so that we can help our patients do what's important to them. Evals established the foundation for the Therapeutic Alliance. Now, I stole this phrase, Therapeutic Alliance, from doctors Carla Wente and Megan, I just forgot her last name, of PhysioSage, and they really talk about this Therapeutic Alliance. The patient PT relationship is not a you give some, I give some, and then we both take some. We need to really look at this relationship as a team effort. We, the therapist, and our patient are on the same team working towards the same goals. And we're playing off of each other's strengths and our motivations and our desires and our passions and our priorities to ultimately achieve whatever goal that we've set for ourselves. And yes, that's a mutual goal here. Evals tell us what is going on with our patient. During the eval, we can perform different tests and measures, and we can ask different questions, and we can perform or administer different questionnaires to figure out, okay, what is the patient experiencing? What could they experience as a result of maybe what's going on in their lives? But it really helps us also figure out, what is the patient most bothered by? How is whatever affecting their lives? And then and it starts to help us know and figure out, what can we really do to help this patient with whatever they're experiencing. And then evals also assure the patient that you are the practitioner who can actually help them. On average, a person with cancer in the United States who's undergoing cancer treatment has 11 specialists that they're seeing. So think about it. We've got medical oncologist, we've maybe got a surgical oncologist, we've got a radiation oncologist, we've got their primary care physician. Sometimes these patients are seeing, for example, like maybe palliative care physician, maybe they're seeing a cardiologist. There's endless specialties that these patients are partaking in, that they're going and seeing the specialists. And so a lot of this, they don't necessarily decide that they want to go to. It's because they've been told that they need to go and see this person, this practitioner, this specialist to help them with blah, 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 blah. And it's really important that these patients feel like the practitioners who are on their team, again, there's that team concept again. It's really important that the patients feel like the practitioners, the healthcare team members that are on their team are actually on their team, that are invested in their care, in helping them and helping to make them better able to do the things that they want to do and they need to do and achieve their goals, whatever they are. And so a really competent and competent eval can assure the patient that you are the physical therapist who can actually help this person do what they want to do and do what's important to them. So in today's workshop, what we're going to cover is the 5 eval elements that we have got to stop leaving out as physical therapists in this year. But we're not going to stop there. We're also going to talk about, how can we actually implement these things back into our evals? Okay, we've identified we've been leaving them out. How do we actually bring them back into the eval so that we can do a holistic, a comprehensive evaluation to actually give us good information so we can make a treatment plan and then get started? And then we're also going to talk about how to dive deeper into improving your oncology evals if this is something that you know you want more help with. So first up, the chart review. We should never go into an evaluation blind. Now, I don't know if anybody's ever done this. I'm going to assume no, but I know I certainly have. I have definitely been screeching in at the last minute behind, maybe I had a patient run late. Maybe I didn't get the chance to, maybe I didn't make the time to actually look over this patient's chart. And my patient knows it. There's nothing worse than showing up unprepared for an evaluation and then basically having to go over things time and time again with your patients that you should have already known. Don't go into your evaluation blind. So what we should be doing is, even if you set aside 5 minutes, literally just 5 minutes at the beginning of your day, at the beginning of your treatment day, to actually do a chart review here. And I know that this might seem a little maybe interesting. I'm not saying do this right before your patient's appointment. I'm saying do this at the beginning of your day. For me, when I start my day and I have the opportunity to kind of look ahead at my schedule or the patients who I know that I want to go and see, I can really prioritize, okay, I know that I need to do this with this patient. I can make a plan for what I want to do. And for my evals, by setting aside this time to chart review, I can really start to identify, okay, what is going on with this patient? What could be going on with this patient? And maybe where do I need to spend my time focused in the eval so that I can make that connection with my patient and get started helping them. So throughout this workshop, I'm going to bring you into different hacks that you can implement in your practice. Hopefully you can see this here. Your bonus hack for implementing or reintegrating the chart review back into your eval is to take notes during this time period so that you can save yourself time later. By taking notes during your chart review at the beginning of the day, this helps you to save really valuable and precious time in two different ways. First and foremost, by reviewing the chart and taking notes in the patient's, documentation in the note, or even in, a little like a notepad with a pen, you are helping to already get your head in the space of, okay, this is what the patient has gone through so far. Here's what maybe they could. And so when you're actually working with your patient in that time period, you're not having them tell you their oncology story for the umpteenth time. Again, maybe this is the first time you're hearing this. They have probably told at least some of those, on average, 11 practitioners, some or all of what they're about to tell you. Save them some wind, right? By taking those notes and doing your work ahead of time, you are actually helping your patients to confirm the information. And this helps them to see that, ooh, they did their homework. They read up on what's going on with me. And then we're already on the same page with a lot of this stuff. So that's the first way here. But also, let's talk from a logistics standpoint. The more chart reviewing you do and the more note taking you do in that time period at the beginning of the day, the less information you have to get during the evaluation and the less time you have to spend at the end of your day documenting. Your time is precious. You should spend your time when you're not on the clock, not at work, with your family, with your friends, doing hobbies, exercising, napping. By doing the chart review ahead of time, by taking these notes, you can shorten that documentation time you need so you can get on with doing the things that you want to do with the rest of your time instead of endless hours after work charting. So number one here. Number two, vitals. I know we've all heard this. Vitals are vital, but they're vital for a reason. So patient story here. I was working inside of a cancer center and I had an evaluation. It was a patient who had metastatic breast cancer. And I knew that she had bone metastases in her hip. It was causing her pain. It was causing her gait dysfunction. And that's partially why she was referred to me. Now, my patient came in and it was in the middle of summer in Texas. So it's miserably hot. She had to hike across the parking lot to get in. She had to go upstairs. She had to go all the way back to where I was. So she was pretty winded and she was sweating by the time that she got in to see me. So when she looked that way, when we were doing the evaluation, it didn't strike any warning chords or warning bells for me. But what did was this patient had mentioned that she was going through, her day and she'd been experiencing this headache for the past 3 days. Now, this started to worry me a little bit. And so at the time, I hadn't done any vitals yet. I was still doing the subjective portion. And so I said, let's check your blood pressure. And lo and behold, this woman had blood pressure that was absolutely in the stroke out range. And so we stopped the evaluation right then and there, called up the oncologist, said, hey, what the heck do you want to do? And we got everything managed. She was put back on her blood pressure medications. Long story short, she came back in. We finished up the eval and we moved on and we didn't have any incidents after that. But unless I had actually checked the evaluation, I wouldn't have really caught on to the idea that something was actually very wrong and it needed to be addressed right then and now. So vitals are vital for a reason. Start with the basics. It's important that we collect vitals in the evaluation again so we can get that baseline, but you don't have to do every single thing under the sun, right? there's a lot of really good information that you can get just from blood pressure, or maybe even just from pulse rate or checking their oxygen. I think people are a lot more comfortable and used to getting their oxygen taken in light of the last couple of years, and you can get lots of really good information from just a couple of these vitals measurements. What I recommend, your hack for this particular eval element, is don't take vitals right away. Patients are oftentimes nervous, anxious, apprehensive of when they come to see us, even if we've interacted with them prior to the evaluation. But if we really want to get a true resting assessment of their vitals, we should wait until they've been at rest for a little bit. And maybe this means that they're sitting down comfortable talking with us. And what I like to do here is I will go through the subjective portion of my evaluation. I'll ask them the questions I want. We'll sit there and talk for a little bit, kind of figure out, okay, what's going on? And then before I do any tests and measures, this is where I'm collecting those vitals. So I get as close to a resting vital assessment as possible. All right, number 3, test and measures. And I'm not just talking about any old test and measures here. I'm talking about the tried and true test and measures, the ones that are going to give you the best information that you can actually use to start helping your patients right now. We have a tendency to way overcomplicate things. So for example, when I was doing evaluations at the very beginning of my Onco PT career, I did every test and measure that was recommended for a particular diagnosis or a particular impairment. And this ate up all of my evaluation time. So oftentimes I would do all these test and measures and they would take up all this time. And then I would literally be chasing my patient down the hall because they were leaving as my next patient was already there. And I would be throwing a home exercise program at them because the test and measures ate up all of my time in my eval. And then when I would ultimately go and document later, because I didn't have any time to document during the eval, the information really wasn't that useful. Don't sacrifice a few good quality test and measures for the sake of having a whole battery of test and measures to do with your patients. So your bonus hack here is think of one diagnosis or impairment that you'll evaluate, or maybe you have evaluated so far in your time as a PT or as a student, for example. So think of that one diagnosis or that one impairment. And I want you to comment in the chat, whatever that is. And we're going to do a little brainstorm right now. We are going to come up with a couple things. Once I hear a balance, dang it, don't use balance because I just said that. What's an impairment or a diagnosis that you could see or you have seen in the patient population who has cancer? I'm going to stop talking before I give away more impairments. Excuse me. Ooh, poor endurance. What a fabulous one. Yes, absolutely. Okay, so let's say a patient is coming in and maybe they're referred for poor endurance. Maybe they're telling you they have poor endurance. What is one test, one objective test, one outcome measure that you could perform to assess their poor endurance? There's lots of answers here, okay? But put in the chat, what's one test that you could do to assess poor endurance? Again, there's like hundreds. That's one of my favorites. 6-minute walk test. Amazing. With that one test, with the 6-minute walk test, for example, or heck, if a patient has really, really, really poor endurance, you could do a 2-minute walk test. But even with just that one test, you could get so much information out of that. First of all, you would get okay, this person walked this far in this amount of time, but you could also analyze their gait during the process. What did it look like as they were walking down whatever distance that was? Did they have any falls? Did they have any near falls? Did they bump into the wall? My patients did that all the time. Did they have to stop? Were they complaining of anything as they were going through this? And just with this one test, you can get so much information. To keep going, I can get posture. I can look at my patient's posture as they're walking, right? There's so many things that I can get out of just one test. Could I do more? Yes. There's tons of tests that we can use to assess poor endurance. But if I really use the test and measure that I've chosen well, and I'm not just looking at the one outcome, in this case, it's distance walked in a period of time, but I can get so much more information out of that one test if I'm thinking through it. So don't make it overly complicated. Use just a couple, maybe one or two test and measures to evaluate each complaint or impairment or diagnosis that you're working with. There we go. All right, number 4. Now, you may be laughing at this one, but number 4 is the patient. And this is in capitals, and this has a period at the end because that's how important this is. Seriously, y'all, the evaluation needs to be focused on the patient. Let's focus that eval back on the patient. Revisiting the concept of the Therapeutic Alliance that we started talking about earlier, it's really easy as a new clinician or as a clinician newer to oncology to try and blast through all of the questions and all of the questionnaires and all of that tests and measures and outcome measures that you need to do or you should do or you could do with this particular patient. And in essence, we have entirely planned out what we need to do, what we want to do, what we think we need to do without really considering what is best for the patient. In order to really be a part of this therapeutic alliance, it's critical that we are really listening to what our patient is telling us from the start, or maybe what our patient is showing us from the start. Your bonus hack for this is to ask them, what is their number one priority? Or what is bothering them the most right here, right now? Because once you identify what that 1 or 2 or however many impairments that's really, really bothering them, chances are, before we get too far, there's going to be 1 or 2 that really rise to the surface that are really bothering your patient. But when your patient identifies what that number 1 impairment or complaint is, that's going to help you know exactly what you need to be doing right here and right now. This patient population, so the oncology patient population, I'm going to wager that they 99.9% of the time come in with more than just one impairment or more than one complaint, because they're getting tons of treatments that are toxic to their bodies, that are trying to kill this cancer and unfortunately carry a lot of side effects with them. And they're usually not getting just one treatment, they're getting multiple treatments. And these patients aren't just cancer patients, right? They also have heart conditions, they have endocrine conditions, they have all these other things that are going on with them. It's very unlikely that this patient is going to come in with a clean cut little, back pain. They could. But the likelihood is your patients are going to have a lot of impairments, and it's easy to get lost in all of that. So this right here, this hack can help you really hone in on what are the quick wins that you and your patient can work towards that are both going to help the patient on their healing journey, but also really help to establish that therapeutic alliance between you and the patient. So by asking them, by figuring out what is the number 1 priority or the number 1 complaint that they have, you can start to formulate a plan that is really going to, again, assure the patient that you are the practitioner that is going to help them, that knows what's going on and is paying attention to what they're experiencing and what they're telling them. Number 5, treatment. Again, y'all heard about how I used to do evals that would take up all of my time, and then I would literally toss home exercise programs at my patients as they went out and I was trying to move on to my next patient. Don't be like Elise, okay? You should not finish the evaluation without starting at least some form of treatment. Now, this could be any number of things. Maybe you're doing some education with your patient. Maybe you're providing them with the start of a home exercise program. Maybe you're instructing them on different exercises or techniques that they can start to implement in their own lives. But you should never leave the eval without at least starting some form of treatment. The reason being is that we should not delay the healing journey any longer. These patients have likely already been experiencing treatment or cancer for a while, and it's affecting them. And every session that we let go by without working towards their goals, their priorities, getting them back to doing what they want to do, what they need to do, it's delaying that healing journey. And by prioritizing that, again, we're really helping to solidify that therapeutic alliance that we, the patient, and you, us, the PT, are on a team together working towards the same common goals. A hack here I would recommend: have a couple home exercise programs or educational handouts ready to go. This may mean that you have to spend a little extra time up on the front end, but by spending that time on the front end to create those programs, those handouts, those home exercise programs, you don't have to do it every single time you come across a patient who needs a similar home exercise program. So for example, let's take our poor endurance impairment that we were talking about earlier. One of my favorite home exercise programs is a walking program. A lot of my patients are very sedentary and really could use a walking program. It builds up their endurance. It helps to decrease fatigue. It helps to introduce some form of physical activity, exercise back into their routine. And so anyways, I think it's a really big bang for your buck. And so I created one. At one point, it probably took me, 15 minutes. And then I saved it. And then every time I had a patient who I knew this was a good starting point for them, I could print it off, hand it to them, and I didn't have to, again, recreate the wheel every single time. I was able to start my patients on whatever treatment this is, talk them through it, educate them, ensure that they understood, and then they were starting that healing journey, even if it was just one more step closer. But they were starting, and they were also starting to understand the expectations that we were setting for our treatment, that they were going to come in and we were going to work and they were going to have to do some work on their own. And so the treatment is more than just, let's get a couple billable units on the eval. This is all part of that therapeutic alliance. And again, helping to really set expectations in order for you both to be successful as part of this therapeutic alliance. So the 5 eval elements that we've got to stop leaving out in 2022. First and foremost, the chart review. Don't go into that eval blind, y'all. Know what you're at least have an idea of what you're going into before you go and see that patient. Number 2, vitals. They're vital for a reason. They can even determine if you need to even stop that eval altogether, but we won't know until we do them. Number 3, test and measures. Not just any of them. We're talking about the tried and true test and measures. Number 4, the patient. Again, this is arguably one of the most important things that we are leaving out of our evals. Center that eval on that patient. Listen to them, figure out what those priorities are so you can start working towards them together. And then number 5, treatment. Don't finish your evals without at least starting, without at least the first step on that healing journey together. Okay, so now it's time to actually go out and ace those evals. Is anyone excited about this? Does anyone love evals as much as I do? So at this point, I am actually going to pause and I'm going to open the floor up. If you have questions, whatever questions you have for me, please pop them in the chat. This is your time, y'all. Give me a little chance to drink some water too. If you're shy, don't be shy. This is a great place to ask whatever questions. If you are a little shy, you don't want to ask me your questions, you can always email me. Email hello@theoncopt.com. More than happy to answer your questions there too. So if you don't have any questions, I have a question for you. Which of the 5 eval elements resonated the most with you? We talked about a few here. Some of them you might already be doing, but maybe there's a couple that you could really lean into more to really integrate more into your evals. So which of these eval elements resonates most with you that you want to incorporate back into your evals this new year? Pop them in the chat. Give me a 1 through 5. You can even do multiple, but let me know what is that eval element that's really resonating with you, that's really clicking with you tonight. Ooh, number 3, test and measures. I'm not gonna lie, this is one of the things I really struggled with as a newer clinician, because again, I like the idea of doing so many tests and measures that it gives me a whole picture of what's going on. Unfortunately, that's usually not how it worked out for me. Yeah. All right. So moving forward here, now that you know what you need to incorporate back into your oncology evaluations, how are you feeling about the rest of your evaluation? You might be feeling some feelings. Feelings are good. Feelings are okay. Let me know in the comments. What are you feeling? How are you feeling about the rest of your eval? If you know that you had a patient who has cancer on your schedule tomorrow, how does that make you feel? How do you feel about doing their evaluation? Let me know in the chat. Confident, intimidated, yes, I would agree with that. Maybe even excited. With this patient population, with the amount, sometimes the laundry list, as I lovingly call it, the laundry list of impairments that they can have, sometimes it can be intimidating to approach that and feel confident and feel like we know what we're doing with that. Yeah, all good ones. As we said earlier, the eval is your first encounter with your patient. You don't have time to waste stumbling through the evaluation. You deserve to ace your evals every single time. Your patient deserves for you to ace your evals every single time. Because again, this is that first step in forming that therapeutic alliance. It's critical that we do a good job so that we can ultimately assure our patient we're the practitioner for them, and to ensure that we know what's going on and that we are working and implementing a plan for success. So I am introducing my new program. This is called Eval Like an Onco PT, and this is going to help you evaluate patients with confidence and start helping them live their best lives now, no matter the diagnosis, no matter the impairments, no matter the complaints that they're coming in with. Oops, hang on, there we go. So Eval Like an Onco PT, by the end of this program, you will have mastered what are the right questions to ask in the eval so that you are really honing in on what is most important with this patient. You'll have mastered performing an evaluation that delivers you usable, useful information, not the endless tests and measures that basically give you the same info that you just spent a whole eval doing, like some of us here. And you'll have mastered the capacity to assure your patients that you know what's going on and that you are the practitioner for them. They will know that by the end of you going through this program. Now, let's talk about the elephant in the room. This is not another course. This is not another continuing ed course where you can hit play on your laptop, leave and go do dishes, which is fine. I do that too. But this is not one of those courses, okay? Because this program, it's live. And it's going to surround you with a supportive learning community. It's going to be you and other practitioners who are working towards actually learning this stuff and then implementing it. There's nothing worse, in my opinion, than going through a continuing education course and thinking, yeah, that was good information, but I don't actually know how I'm going to use it in my practice. Or I don't know how I'm going to actually implement that with the patients that I'm seeing on Monday morning. But perhaps most importantly, this program is going to provide you with the accountability to actually learn the stuff, to get that material down, and then actually implement it. Actually use it in your practice with your patients so that you can start evaluating like a confident and competent Onco-PT. Now, this program, I have two different payment options. It's $3.99 for a one-time payment, or we can do installments. You can pay now for $133, and then there will be 2 more monthly payments of $133. With this program, you'll have lifetime access to the material. And as you're going through this program, you'll have me to guide you through this process every step of the way, along with your peers who are working towards this with you. So what do you need to do from here? If you're some of these people, if you're out there and you're watching this and you're thinking, oh my God, this is me, here's what to do next. You're going to click the link. If you're watching this live, it's in the chat. Otherwise, it will be below this workshop, the replay. You're going to grab your seat and we're going to start acing your evals today. Again, it's time to ace those evals. It's time for your patients to know that you can help them. And it's time for you to know that you can go into every eval and get the most pertinent information to actually prioritize what's going on with your patient, to hone in on those impairments and implement a plan for success. Thank you so much for watching today's workshop. I hope to see you inside the Eval Like an Onco-PT program, and I hope you have a great rest of your day. I'll stay on for a couple minutes if y'all have any questions, but otherwise, I'll see you inside the Eval Like an Onco-PT program. Yeah, Karen, you're welcome. So we are not recording